Good evening, everyone. I wanted to do a video about testosterone shots. I have only taken 3 so far. My third was this morning. I started on May 13th, and I have taken 50 milligrams every 2 weeks. Testosterone comes in a little box that looks very much like that, or it can come in a pill bottle. However, what I take again is an injection form, and the bottle itself looks like this. This is depot testosterone. You use a needle, you stab that little rubber piece at the top after you clean it off with an alcoholic wipe or rubbing alcohol. And I'm going to run you through the steps without demonstrating. I've already taken my shot today. I can demonstrate 2 weeks from now when I take my next one. What the nurse did when I went to my campus health clinic and learned how to take my shots was she practiced, or rather she showed me, demonstrated, the first time around with saline. And she gave me the saline bottle so that I could practice any time I wasn't feeling quite sure of myself. She demonstrated once with a 1 cc syringe and a 22G, I'm not sure what the G stands for, needle. And the needle itself is that portion right there. This particular needle is 1.5 inches long. Only about 75% of that, or 3/4 of an inch, goes into your leg. However, if you have a 22G, again, I don't know what the G stands for, needle, and it is 1 inch long, all 1 inches of that goes into your leg. So that would mean, so you see how long that needle is? That would mean about that much of it, as long as my index finger from here until about here, 1 inch of it, 1 inch of it goes into your leg. And that would be right up to the hilt of the needle, where it then connects to the syringe. I take 50 milligrams. 50 milligrams on a 1 cc syringe. If you can see it, I don't know if you really can. If you can see the two, if you can see the two right about there, halfway between the 2 and the 3 is approximately there. That is 50 milligrams on a 1 cc syringe. On a 3 cc syringe, which is what this is, on a 3 cc syringe, I'm not entirely sure where it's at because I've only seen the nurse demonstrate it once, and she just drew back on the plunger to fill it with air. So how she demonstrated it was she took the plunger. I'm going to say this is the needle wrapper, even though it's a needle and a syringe. She took the plunger wrapper and the needle wrapper. She set those on the desk. She laid down a paper towel to, have a sterile surface. She washed her hands. She got the alcohol wipies. She got the testosterone. Well, she demonstrated the saline. Anyway, she got the saline. She had everything nice and laid out. She cleaned off the saline bottle by twisting her thumb around the rubber cap, which is that. See that right in the center? That's rubber. She cleaned that off. She set that aside. She opened up the syringe wrapper, set that aside. She opened up the needle wrapper, set that aside. Then she took out the syringe, and without touching any part of the needle, again, there's this plastic covering on it that keeps you from touching the needle, so it's nice and sterile. She screwed that onto the syringe. She set that aside. She made sure that I was cool with all of the parts so far, understood what was going on. Then she took the outer plastic and paper wrapping, this thing, took that off, set it in the trash pile. We had a trash pile at that time because she was showing me everything, and once you take something out of the wrapper, it's no longer sterile, so you can't really use it without risking staph infection, which sucks. By the way, don't ever reuse needles or syringes because you are risking staph infection, and staph infection is horrible stuff. So don't even risk it. Just use a new needle every time. Use a new syringe every time. I'll get into that more later. So she had the still capped needle. Again, the cap is this thing right here, this hard plastic thing that's making sure that I'm not stabbing myself right now. She had that still on the needle, now connected to the 1 cc syringe. She drew back on the plunger while the needle was still capped until the plunger reached the 2.5 mark on this, the 1 cc syringe. She made sure I could see where it was, showed it to me, pushed the plunger back and forth a few times so I could get the feel for it. Then she gently, very, very gently wiggled the plastic cap off of the needle. You just want to wiggle it back and forth until it comes off, nice and easy. At that time, the needle is uncapped. You can stab yourself, so be careful. There is also, and you can't really see it very well through the wrapper, but there is a thing right at the base there that slides up the shaft of the needle when you're done using it. And you can slide it back and forth, but you might as well just keep it in the cap until you're actually ready to use it. I'll talk about that again in a minute. So she got the plunger down to where it was supposed to be. She took out the saline. She stuck the needle into the saline while the saline was right side up. Then she pushed out all of the air into the saline bottle, the actual fluid itself. The needle was sitting inside the fluid. You can even see the fluid. See it wiggling around in there? All the air bubbles came out. She tipped it upside down, pulled back down slowly until the syringe filled up to exactly where she wanted it to be, and to the 2.5 mark. She tipped it back up this way again, withdrew the needle until it was still inside but above the fluid line, pulled back just a tiny bit more until the air bubble, you want to make sure there's an air bubble sitting against the plunger. My cat was on my lap and he just scratched my leg. Dirty little bastard. So you want to get an air bubble sitting right up against that 2.5 mark. The air bubble can be a fairly good size. You want it to be a fairly good size because that's going to close up your wound when your little puncture mark when you're done. So she got that sitting up against the plunger while the plunger is upside down, meaning while your needle and everything is pointing down this way, you want the air bubble sitting up against the plunger. She showed me exactly where everything was at. Turned it upside down, right side up, so that I could see the air bubble moving around in there. Made sure that I understood everything. And then removed the, I think she then removed it from the saline bottle. What you can do after this point is slide the little plastic protective thing up the shaft of the needle to make sure you don't stab yourself with the tip. It's not the cap, it's what's connected to the needle itself. And you can still see the middle part of the needle exposed, but at the base and at the top is where this little protective piece is. I'm not really sure what it's called, I just call it a little detective think, Jesus Christ, you really made that bleed. Wow. Anyway, I should probably watch that. I'll do that in a minute. He really made that bleed, man. It's like that much. He just clawed me. You little jerk. What did she do after that? Oh, she then demonstrated how to wipe the leg, the thigh, about where you want to space it. You want 4 fingers in from the patella, your kneecap, and you want about 4 fingers from the crease of your hip and thigh, where your thigh meets your pelvis. So where your leg meets your torso area, 4 fingers from that at least. You want the nice long quadricep muscle. You're going to be jabbing into that. And you don't want to get too far to the side. You want to stay mostly at the outside top, I would say, of your leg. She demonstrated with a wipey what I wanted to do with that. You clean an area with the wipey, different from the one that you use to clean off the top of the testosterone bottle. You don't want to use the same one. Set that aside. All the trash you set into a different pile. However, not your syringe and your needles. Those go into a container that I'll show you in a couple. She didn't do this part, but she told me what to do. You then set your needle perpendicular to your leg, not touching yet, and you spread the skin with your fingers to make sure it's taut. Then you slowly inject the needle into your skin until it's either, depending on the length of your needle, 75% of the way in or up to the hilt if it's 1 inch, 1.5 inches, or an inch, respectively. 75% of the way in if it's 1.5 inches, all the way in if it's 1 inch. That gets it into the muscle. She said that you could do it fast. However, when I tried to do it fast in the office, my needle bounced off my skin. That hurt. I don't recommend doing it fast. I recommend doing it slow. You push it all the way in. You draw back just a tiny bit to make sure there's no blood. If there is blood, you have either nicked a capillary or you're sitting in a vein, or nicked a vein. You don't want to inject in a vein. You want to inject in the muscle. This is called incutaneous injection, or intramuscular. I think it's called both. Anyway, if there is blood in the syringe, you have 2 options. You can either throw out that needle and that syringe because the testosterone is no longer sanitary. But if you do that, you're wasting your medication. So it's really up to you. Or, and I don't directly recommend that you do this, but this is what I would personally do. And the nurses really don't want to hear if you do this, by the way. Or you simply inject it into your muscle. Hopefully it's your muscle. Most likely you've just nicked a capillary. Most likely that's all that's happened. So you then, once you've decided whether or not you're going to push it in still, if there's blood, or hopefully there's no blood. If there's no blood, you can just push it in and you're fine. But it takes a while to push in, just as it took a while to draw the testosterone out of the bottle. Testosterone is pretty thick. It's a hormone. It's kind of an oily sort of substance. A little bit like vitamin E. If you've ever used vitamin E extract for anything, it kind of feels like that. So you slowly inject it, that air bubble's sitting at the top of your plunger, and you're watching it go down and down and down, and then suddenly it's in the needle, and then it's into your leg. And mostly it doesn't really feel like anything. Every time I've injected, I haven't felt anything other than maybe a slight pressure when the needle's going into the skin. Maybe. But that's really it. I have not had any pain whatsoever from my 3 injections. Now that that's only been 3 injections, so I can't speak for everybody, and I can't speak for my future experiences. Then what you can do is I let it sit in there for a couple of seconds longer, and I slowly pull back out, straight out. Once it's all the way out, I rub my skin a little bit to try to close up the path of the needle so that nothing really comes out. But every once in a while something does. If a little bit of testosterone leaks or a little bit of blood leaks, that's fine, don't worry about it, that's normal. And you might feel then the vitamin E sort of oil on your fingers or on your skin. And again, it's normal, don't worry if a little bit leaks out. It's a tiny, tiny, tiny amount in comparison to what you've just stuck yourself with. He was trying to get back up on my leg. Once you're done with that needle, once that needle is out of your leg, you want to slide that thing up shaft, screw it off, or unscrew it, and then you got something like this, which holds all of your needles and syringes after you've used them. See them in there? You can take this to a place that will dispose of these, or you can send it in. I'm going to just take mine to my campus and have them dispose of it. This is, I think, $4 at Walgreens. Walgreens is a local pharmacy chain. You can get them at CVS. I'm sure you can get them at a lot of different places. Osco's. Osco's? Is that what it's called? Osco's. Anyway, whatever your local pharmacy is, ask them. Walmart might carry them. But yeah, see how it says biohazard right there? Pretty cool, huh? So you want to keep these out of reach of small children, medium-sized children, any immature people, people that might use them for nefarious purposes, or dogs or cats if your dogs or cats are stupid like mine and like to eat things they shouldn't. Keep them up in a cupboard somewhere well out of reach. I think that's pretty much everything. I swap out my needle between when I take it out of the bottle and when I stick it into my skin. I do that every time because I want to minimize the pain or the pressure. I want to make sure that I feel as little as possible. And also I don't want to give myself too much scar tissue. Every time you give yourself a shot, you want to rotate legs and rotate where on your leg you're giving yourself a shot. That will help to minimize scar tissue. So say 2 weeks from now, I will be giving myself a shot in my left leg in a different place than where I gave it to myself Monday before last. The first time I gave myself a shot, it was in my right leg. The second time was in my left leg. Monday, this morning, it was in my right leg. Next time, 2 Mondays from now, will be my left leg. Just back and forth in different places, rotating. I think that's about it for now. The video is quite a bit longer than they usually are. 2 Mondays from now, I'll be seeing about actually demonstrating so you can see, for those of you that are interested, so that you can actually see the testosterone in the syringe, the needle on the syringe, and the needle in my leg. And I'll do it step by step so that you can see everything. And I might forget a step, but if I do, then that means then I'm like, oh wait, something's not right, and I have to backtrack just a little bit because I might not have the air bubble in there, or I might not have switched out the needles or something. So stay tuned and you'll get to see me stab myself with a needle. But don't worry, it'll be good it'd be a good reason. Well, stay tuned folks, and I'll see you next time.